Good day to you all. I am Magabong Ngube, and today I am going to be presenting on barium as a drug. Just to begin with, we have to know what barium is. And from the chemistry that we all know, barium is a chemical element, one of the alkaline earth metals. The element is used in metallurgy, which is just the production of metal. And then its compounds are used in pyrotechnics, petroleum production, and in radiology, which is what we are most concerned with. Barium in radiology. So the barium sulfate compound is used, but often just called barium in the radiology department. This drug is used as a contrast agent, meaning that it is introduced into the body in order to improve the visibility of internal structures. Barium sulfate is used to examine the gastrointestinal tract using X-rays or computed tomography in adults and pediatric patients. Reasons why these barium GI tract examinations are done include abdominal pain, bleeding from the rectum, difficulty swallowing, unusual bloating, and many others. So this is just a picture to show us how barium sulfate looks like. It's just a white chalky powder, as we can all see from the image. So there are three main types of barium procedures. Firstly, there is what is known as barium enema, which is a procedure that is done to examine the lower gastrointestinal series, which comprises mostly of the colon and the large intestines. And then we have the barium small bowel follow through, which is used to examine the small intestines. And then we have the barium swallow, which is used to examine the upper gastrointestinal series, which comprises of the esophagus, the stomach, and the duodenum. The routes of administration. So there are two ways in which barium is administered. It can either be administered orally, which is known as the barium swallow, or it can be administered rectally by a procedure which is the barium enema. So for barium swallow, the barium comes as a powder or tablet. The powder is mixed with water to form a thick milkshake-like drink. It is usually flavored with chocolate or strawberry, and this makes it easy for the patient to swallow the drink. So as the patient swallows the barium contrast, a series of X-rays will show the barium moving through the gastrointestinal tract. So as the patient swallows the barium contrast, the radiographer will take a series of X-rays and they will show how the barium is moving down the patient's GI tract. And then we have the barium enema. So a lubricated enema tube is inserted into the rectum. Barium is then injected through this tube into the colon and the rectum. Then X-rays are then taken. So the barium enema will show us the lower GI tract organs. And in addition to drinking barium, A is often inserted into the bowel for a lower GI tract X-ray. For the upper GI, patients may be given baking soda crystals. This enhances visualization of the GI tract organs, and this is known as the double contrast procedure. So if barium is used together with another substance, it is known as a double contrast procedure. So patient is asked not to eat or drink liquids for 8 hours before a barium procedure is done. We'll now look at the mechanism of action of barium sulfate. Barium is an X-ray absorber, so it will appear white on the X-ray film. Barium works by coating the inside wall of the upper GI tract organs, the lower GI tract organs as well. It covers the mucosal surface of the GI tract so that the lining wall, function, size, and shape of the organs are visible. This enhances the visibility of the diseased or damaged area on the X-ray or CT scan. So these are just two X-rays showing us how barium will coat the walls of the GI tract organs. So the first image shows us barium coating the upper GI series, and the second image shows us barium coating the lower GI series. Barium is not absorbed or metabolized by the body, hence it is excreted normally from the body. However, it has some side effects to the body, which may include trouble with bowel movements, pain or swelling of the abdomen, stools that are smaller in size, and a fever. This is the end of my presentation.